Gout is a common and painful form of arthritis that has afflicted humans for centuries. It is characterized by sudden and severe attacks of pain, redness, swelling, and tenderness in the joints, most commonly affecting the big toe. This overview delves into the essential aspects of gout, including its causes, symptoms, diagnosis, treatment, and prevention strategies. Causes of gout. Gout is primarily caused by the accumulation of uric acid crystals in the joints and tissues. Uric acid is a natural waste product that forms when the body breaks down purines, which are substances found in many foods and drinks. Typically, uric acid dissolves in the blood and is excreted through the kidneys. However, in some individuals, the body produces too much uric acid or has difficulty excreting it, leading to elevated levels in the blood, a condition known as hyperuricemia. Hyperuricemia can be attributed to various factors, including diet. Consuming foods high in purines, such as red meat, seafood, and alcohol, can increase uric acid levels. Genetics. A family history of gout can predispose individuals to the condition. Medical conditions. Certain diseases, like hypertension, diabetes, and kidney disease, can contribute to elevated uric acid levels. Medications. Some medications, like diuretics and aspirin, can interfere with uric acid metabolism. Symptoms of gout. Gout typically presents as acute attacks characterized by the following symptoms. Sudden and intense joint pain, often starting in the big toe but can affect other joints like the ankles, knees, wrists, and fingers. Swelling, redness, and warmth around the affected joint. Tenderness and extreme sensitivity to touch. Limited range of motion in the joint. Fever may accompany severe gout attacks. Gout attacks can last for several days or weeks, and they tend to recur if not properly managed. Diagnosis of gout. Diagnosing gout involves a combination of clinical evaluation, medical history review, and laboratory tests. A physician will typically examine the affected joint to assess for signs of inflammation, like redness and swelling. Ask about the patient's medical history, diet, and family history of gout. Order blood tests to measure uric acid levels. However, normal uric acid levels do not rule out gout, and elevated levels do not confirm it. Aspirate fluid from the affected joint to check for the presence of uric acid crystals, which is the most definitive diagnostic test for gout. Gout complications. If left untreated or poorly managed, gout can lead to several complications, including recurrent attacks. Gout attacks can become more frequent and severe over time, causing significant pain and joint damage. Joint damage. Chronic gout can lead to joint damage and deformities due to the accumulation of uric acid crystals in the joints. Tophi. Uric acid crystals can also form small, chalky deposits under the skin, tophi, which can cause lumps and joint deformities. Kidney stones. High uric acid levels may result in the formation of kidney stones, a painful condition that requires medical intervention. Treatment of gout. The management of gout aims to alleviate pain, reduce inflammation, and prevent future attacks. Treatment options include medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, colchicine, and corticosteroids can help relieve pain and inflammation during acute gout attacks. Urate-lowering therapy. For individuals with recurrent gout attacks or tophi, medications like allopurinol and febuxostat are prescribed to lower uric acid levels. Lifestyle changes. Adopting a low purine diet, limiting alcohol intake, maintaining a healthy weight, and staying hydrated can help prevent gout attacks. Joint aspiration. Draining the affected joint can provide relief and reduce inflammation during severe gout attacks. Prevention of gout. Preventing gout and its recurrence involves making lifestyle changes and adhering to prescribed medications. Key preventive measures include dietary modifications, limiting the consumption of high-purine foods like organ meats, red meat, and certain seafood can help reduce uric acid production. Hydration, staying well hydrated helps the body excrete excess uric acid more efficiently. Moderating alcohol, reducing alcohol intake, especially beer and spirits, can lower the risk of gout attacks. Maintaining a healthy weight. Obesity is a risk factor for gout, so losing excess weight can be beneficial. Medications. If prescribed urate-lowering therapy, it is crucial to take it regularly as directed by a healthcare provider. Conclusion. Gout is a painful and potentially debilitating form of arthritis that results from the accumulation of uric acid crystals in the joints. While it can be a lifelong condition, proper management through lifestyle changes and medication can significantly reduce the frequency and severity of gout attacks, improving the quality of life for those affected. Early diagnosis and prompt treatment are essential in minimizing the long-term complications associated with this condition. If you suspect you have gout or have a family history of the condition, consult a healthcare professional for a comprehensive evaluation and personalized treatment plan.